Hi guys, I wanted to make you guys a video about surgical technique and give you one exercise you can do at home to improve your needle control. So the only thing you need for that is this needle driver and a folded up towel. Before we talk about that though, I'm going to give you a really quick overview of surgical needles. Here is some very basics about surgical needle anatomy. You can see from this top diagram here, there's three parts of the needle: the point, the body, and the eye. The eye is also where the suture connects, and it can be either connected permanently or a pop-off. So when it's connected permanently, that's called swedged on. You can measure the needles in various ways. So there's the cord length, which is straight across. There's the needle length. There's also the radius and the needle diameter. Now, the needles I'm going to show you right now have either one of these 2 points. So the taper point needle is sharp at the tip, but then the body is smooth. And so that minimizes any tissue damage as you're moving the needle through the tissue. This reverse cutting needle, and the one I'm showing you is mainly used for vascular, has sharp edges, so it will cut through the tissue as it's turning. Here is a diagram of the main needles we use in general surgery. Of course, there's many more. And I'm actually going to start with this one because this is the one we're going to practice with. It's called an SH needle. It's commonly used for all the trauma, 3/0 silk pops in the OR, for suture ligatures, etc. So it's a good needle to get familiar with. The bigger needles we use are a CT1, a CTX, and this TP1. If it looks familiar, it's because that's the one we use on our number 1 looped PDS to close fascia. I call it the pirate needle. Another great needle is this UR6, and if you notice, this needle has more of a curvature, so these are 180 degrees, and this UR6 has more than that, and that's what we use for the laparoscopic 12 millimeter port sites to close the fascia. And because it has a tighter curvature, that's what allows you to place it into that narrow incision and actually get good purchase on each bite you take. Finally, coming back up here, I just threw this one in mainly for kicks. This is a PS2, it's a reverse cutting needle. I found it on a 7/0 suture, usually used in the vascular world. And that's the reverse cutting. I'm going to show you this exercise, and I want to keep this video under 5 minutes if I can. So this is a needle control exercise, and I'm not quite sure how I'm going to do this while I'm holding the camera, but that's the point. You can do it with one hand. You're going to prop this towel up and just hold it between your legs. And this is an exercise in just knowing where your needle tip is and being able to control it. So you take your SAH needle. Mine is not loaded perfectly, but we'll just do it. So you want to take a bite through, one side of your incision. Let it go. See how it's just resting there? You don't need to grab it with your Adsons. You don't need anything else. You're going to grab it through here, turn your wrist, and come out. And again, take it through the other side. Imagine you're closing skin. So you can gently move it across and then re-grab it so it's loaded. And that's it. That's the entire exercise. So I like this exercise because it's helping me get better kind of needle control, tip control. You're not depending on your Adson to stabilize, and it gives you more confidence in the OR because you know where your tip is, you know you can control the point of the needle, and you know you can re-grab it. So that's my cat. So I think this is a great exercise for anyone at pretty much any level of surgical training to practice. and it's just going to help you have more confidence in the OR. Thank you very much. I hope you like this video.